Can you sit, please?
Lymphatic system. Inspection lymph nodes in occipital post-auricular, anterior auricular, tonsils, submandibular, submental, neck, anterior and posterior between legs of sternocleidomastoideus, supraclavicular, infraclavicular, armpit, epitrochlear, groin, and popliteal are invisible, not hyperemic, with no ulceration. By palpation, submandibular lymph nodes palpable, soft, elastic 1 cm in size, painless, easy mobile, not connected to the surrounding tissue, single in each side.
Number 10, muscular system.
Can you turn, please? It's okay.
Muscular system. Good development, symmetrical, no visible atrophy or hypertrophy of some muscles or group of muscles. Convulsions, tremor, and asterisks are absent. Hyperkinetic disorders are not present. Muscular tension is normal, no stiffness, not decreased, not increased. Scale for grading muscle strength is 5. Muscular system palpation.
If you feel pain, you tell me, okay?
Okay.
Can you turn, please?
Muscular system, good development, symmetrical, no visible atrophy or hypertrophy of some muscles or group of muscles. Convulsions, tremor, and asterisks are absent. Hyperkinetic disorders are not present. Muscular tension is normal. No stiffness, not decreased, not increased. Scale for grading muscle strength is 5.
Asterixis. Asterixis is a tremor of the hand when the wrist is extended, sometimes said to resemble a bird flapping its wings. It's related to hepatic disease, renal failure, respiratory failure, and Wilson's disease. Convulsion. It is a medical condition where body muscles contract and relax repeatedly and rapidly. In tonic phase, the skeletal muscle will suddenly tense, often causing the extremities to be pulled towards the body or rigidly pushed away from it, which will cause the person to fall and standing or sitting. In clonic phase, the person's muscle will start to contract and relax rapidly, causing convulsions. This may range from exaggerated twitches of the limbs to violent shaking or vibrating of the stiffened extremities. Rigidity in Parkinson's disease. Patient shows tremor of head, hands, and lower limbs, stopped posture, mask-like facial features, and back rigidity. Grade muscle strength. 0. No evidence of movement. 1. Trace of movement. 2. Full range of motion but no against gravity. Passive movement only. 3. Full range of motion against gravity but not against resistance. 4. Full range of motion against gravity and resistance but weak. 5. Full range of motion against gravity, full resistance. Skeletal muscle movements. Spasticity. Hypertonus or hyperflexia are all terms used to describe abnormal high muscle tone, which is a common occurrence following stroke and other neurological conditions such as brain injury, multiple sclerosis, and spinal cord injury. Number 10, splinter hemorrhage, infective endocarditis. 11, yellow nail, due to lymphedema, bronchiectasis, or lymphoma. Number 12, half and half nail, due to hepatic cirrhosis. Number 13, ridging, due to rheumatoid arthritis. Number 14, longitudinal brown lines, Addison's disease, breast cancer, or melanoma. Number 15, white nails in anemia. Number 16, red nails in polycythemia or systemic lupus erythematosus. Number 17, horizontal white and pink bands in nephrotic syndrome. Number 18, brittle nail in detergent and water hypothyroidism. Tremor.
Can you do like this now and hold for a minute, please?
Tremor is negative. Asterixis.
Can you do like this and hold for a minute, please?
Asterixis is negative. Tension, strength, and movement.
Can you hold my hand? The other? Press as you can. It's okay. Try to hold, okay? It's okay. With one hand, then do like this, please. It's okay. Do the opposite now. It's okay. Can you do like this, please? No, like this. Can you hold this paper?
Grade muscle strength. 0, no evidence of movement. 1, trace of movement. 2, full range of motion but no against gravity, passive movement only. 3, full range of motion against gravity but not against resistance. 4, full range of motion against gravity and resistance but weak. 5, full range of motion against gravity, full resistance. 11 bones.
Contact, please. When you feel pain, tell me, okay?
Alright. Bone well developed, symmetrical, no visible deformities, acromegaly, finger clubbing, genus varum and vagum are absent, no other disorders are present, but palpation, no tenderness, periostite or osalgia.
Bones disorders, genu valgum and genu varum. Marfan syndrome, inherited disorder of the connective tissue associated with long, thin extremities, loose joints, arachnodactyly, and kyphoscoliosis. Reduced vision due to dislocation of lens is also present. Aortic aneurysm. Paget's disease, excessive reabsorption of bone by osteoclasts and compensatory disorganized deposition of new bone. Rachitic rosary, the prominent knobs of the bone at the costochondral joints of rickets patient are known as rachitic rosary or beading of the ribs. Wind-swept deformities of rickets. 12. Joints.
Can I turn, please? If you feel pain, tell me, okay? See, please. Can you move your head, please? Like this. Okay? The same as the shoulder. This, up, down, rotate. The another one, please. If you are one out, other movements that you can do. With the wrist, please. Phalanges, or can you do this? May you like, please. Flex, yes, like this. Down. Another, please. Once more, like this. Now you do like this and this, and the other side. Now it goes like this. Can you move your feet? Can you move out like without pain?
Joints. Size not increased, not decreased, there is no deformities, skin color changes and swelling. Temperature above them is normal, not cool, not warm, painless.
Balutin sign. Balutin signs negative. Test for a fusion of the knee joint. First one, bald sign.
Relax, please.
Second, balloon sign.
Relax, please.
Prayer hands. Figure A. The prayer sign is a simple clinical test that may be used to detect limited joint mobility in the hands, inability of the patient to completely close the gaps between opposite palms and fingers when pressing the hands together in a praying position constitute a positive prayer sign. Figure B. Improvement is seen in a patient after he received 4 months of aggressive glycemic control.
Rheumatoid arthritis. Rheumatoid arthritis. Gout.
Joint effusion. Swelling from excess fluid in the joint capsule, here from rheumatoid arthritis. Best observed anteriorly. Fluctuant to palpation. Considerable fluid must be present to cause visible distension because the capsule normal is loose. Olecranon bursitis. Large knob, or goose egg, and redness due to inflammation of olecranon bursa. Localized and easy to see because bursa lies just under skin. Gout arthritis. Joint effusion or synovial thickening seen first as bulge or fullness in groove on either side of electron process. Redness and heat can extend beyond area of synovial membrane, soft, boggy, or fluctuation fullness to palpation. Subcutaneous nodules, raised, firm, non-tender nodules. These nodules occur with rheumatoid arthritis. Common sites are in olecranon bursa and along extensor surface of ulna. Skin slides freely over the nodules. Ganglion, round, cystic, non-tender nodule overlying a tendon, sheath, or joint capsule, usually on dorsal of the wrist. Flexion makes it more prominent. A common benign tumor, it does not become malignant.
Conditions caused by chronic rheumatoid arthritis. Swan neck deformity. Flexion contracture resembles curve of a swan neck. Note flexion contracture of metacarpophalangeal joint, then hypertension of the proximal interphalangeal joint, and flexion of the distal interphalangeal joint. It's often accompanied by the ulnar drift of the fingers.
Conditions caused by chronic rheumatoid arthritis. Boutonniere deformity. In this condition, the knuckle looks as if it were being pushed through a butthole. It is a relatively common deformity and includes flexion of proximal interphalangeal joint with compensatory hyperextension of distal interphalangeal joint. Ulnar deviation or drift. Finger drift to the ulnar side because of the stretching of the articular capsule and muscular imbalance. This is caused by chronic rheumatoid arthritis.
Heberden's and Bouchard's node. Bouchard's nodes. Heberden's nodes. Vertebral column.
When you feel pain, you tell me, okay?
Okay.
Can you bend?
Vertebral column. Shape is normal, with no pathological curvatures. Movement of spinal cord is full in volume, active, without pain and crepitation.
Ankylosing spondylitis is a chronic inflammatory disease of the axial skeleton with variable involvement of peripheral joints and non-articular structures.
Scheuermann's disease. Scheuermann's disease describes a condition where the vertebrae grow unevenly. This uneven growth results in the signature wedging shape of the vertebrae, causing kyphosis. Lordose. Lordose refers to the normal inward curvature of the lumbar and cervical regions of the spine. Hyperlordose can happen and this is commonly referred to as sway back or saddle back. A major effect of lordose is forward pelvic tilt, when the pelvis tips forward when resting on top of the thighs.
Kyphosis is a condition of overcurvature of the thoracic vertebrae. It can be either the result of degenerative disease, developmental problems, osteoporosis with compression fractures of the vertebrae, or trauma. Scoliotic spine is a medical condition in which a person's spine is curved from the side to the side. On X-ray, the spine of individual with scoliosis can resemble an S.
Can you bend forward without flexing your feet?
Schober's sign is normal, more than 4 centimeters.
Schober test. The Schober test detects reduced flexion. With the patient standing, mark the skin overlying the fifth lumbar spinal process, and also 10 centimeters above. On forward flexion, this should increase to 15 centimeters or more. Number 13, neck.
You take the bottle when I say, okay?
Okay.
You can take. Once more, please. Can you take some source of water, please? Once more, please. It's okay. Another side, please. Can you take water, please? Once more, please. That's all.
Neck. There's no visible enlargement or deformity of the neck or thyroid gland. Changes above the skin, stalks color are absent. There is no visible pulsation of vessels and no visible tortuous veins of the neck. By palpation, lobes are unpalpable. Isthmus is palpable about distal thumb phalanx size, soft and smooth surface.
Lymphoma of the neck. Lymphoma is a form of cancer that affects the lymph nodes of the body, particularly in the neck. Lymphoma is a serious disease which requires specialized medical care to treat, but it can be difficult to tell the difference between lymphoma and another type of inflammation or illness which affects the lymph nodes. Parenchymatous goiter or bronchocele. This is a